David Hawkins at Seattle at the University of Washington and I helped develop the mechanism for crowdsourcing of ideas. And so on the website for the American Academy of Social Work and Social Welfare, we invited people to give us ideas of what would be a good topic for a grand challenge. And we had as a guideline that these papers had to address some of the critical criteria that we thought for a grand challenge. One of which is that the issue had to be big and compelling and engaging. So we didn't want a small grand challenge. We wanted something really important, really big. We also wanted the grand challenge to be something that would be based on science, again, following the theme of science of social work and so forth. So it had to be an issue about which something was known, and that we knew something about the grand challenge that was going to be proposed, and that we could do something about it.
The idea of productive aging is, don't you think, Tina, to help us get past the idea that when we retire, we only have 5 years left to live. It's this idea that we have a lot more years to live, that 20 or 30 years of thinking of retirement as just leisure is not something that's very attractive to a lot of people, and that there are opportunities to, as you said, take advantage of this incredible resource, older adults with education, with talent, with experience, to continue to contribute to society in multiple ways.
There are portions of the older adult population that tend to be excluded from these activities. It's really important to maximize opportunities for engagement in these diverse types of productive activities into the extended lifespan, right? And so if traditional retirement age has been 65, yet we're expecting to live 20 or 30 more years, we really need to be sure as a society that we're providing opportunities for people to work as long as they need to or want to, and that health is employment is healthy for them, the work conditions are healthy for them, that volunteer opportunities are plentiful and available, and that caregiving is supported. We all know that a lot of times caregiving responsibilities come up and take people out of work. And so supporting people so that they are able to continue working and also provide caregiving, or maybe provide income support to those who are providing caregiving so that they can support themselves financially.
The important thing about isolation is that it means that you have limited social contacts, people that you can call on for help, people with whom you could converse about important matters, people whom you might relate to or rely on for important services and so forth. So it's sort of like that reservoir of help. I like to suggest that all of us encounter the slings and arrows of life, but we get by with a little help from our friends and our family and so forth when these crises hit. And those people who don't have that reservoir are the ones who are most vulnerable.
Right, absolutely. And I would agree. I think that human contact is a fundamental human need. That no matter how self-sufficient somebody feels and how comfortable someone feels on their own, there really is this need for contact with other human beings. And there is in our country a lot of people who don't feel like they have someone that they can call if they need something. And again, it's for emotional support, but it's also for things like if you need to go to the doctor, if you need to talk through something with someone, and not having that resource can become a risk factor for many other problems down the road. That's why it's sort of important to not just, it's sort of been seen historically as an issue that is more affecting older people. But what we're trying to do in this grand challenge is to really open the door and to look at other populations. So for example, solitary confinement in prisons. This is something that is used quite frequently, and that has been seen as a human rights violation because, again, we have this fundamental need for human contact.
Research shows that societies where there are big contrasts between different groups of society, they get their social fabric gets disrupted, and when you have this lack of cohesion in the social fabric, the impact is for everyone. You have economic impact. You have less civic participation, less lower trust on one another, and that has an impact for everyone that lives in this society. So by not closing the gap, but by not working towards achieving equal opportunity, that's what we are talking about in the grand challenges. We are not talking about hands out. We are not talking about welfare. We are talking about everyone having the same opportunity to the means for advancement: education, healthcare, having housing, living in an environment that is not polluted, not being exposed to violence in your neighborhood, being able to access nutritious and food that is of high quality. All these social determinants have a big impact, not only on the communities that lack access to, but on everyone. So this is something, that's why we launch this grand challenge, because this is a grand challenge for everyone in society.
The book really is a platform that we hope now gets used in classrooms. We hope that doctoral students will start to see their research, dissertation research, in one or more of the grand challenges, start using that language. We hope that social work curriculum starts to maybe get reorganized to focus on this. But we also realize that more has to be done. And so the book has at least the 12 chapters and the 12 grand challenges, plus a chapter on the history of this whole movement, and then kind of a summary. But we're now in the process of developing what we call small books for each one of the grand challenges. And these small books will have as a targeted audience high school students or college students, because we really are trying to recruit people to the field of social work or even other professions to help address what we consider to be some of the critical issues of our time.